With all the blessings of Lord Dhanvantari, let us start February 16 of Prabodhini webinar series. So before starting the scientific session, let us just revise the rules and regulations of Prabodhini webinar series once. I know all the delegates are here and our guest is also arrived, and our today's webinar moderator has also arrived. So we all will be starting the scientific session very soon. Before that, let us just revise the rules and regulations. The Prabodhini webinar series is organized by Shri Babu Singh Ayurvedic Medical College and Hospital, Farrukhabad, UP. And we all know that Ayurveda is the gift of ancient sages. It is the inheritance of our ancient people, and all the knowledge we receive from them is in the mode of encrypted Sanskrit texts, all the shlokas, and we need to decode them to understand the real meaning, for which we need a guide, a real teacher who can explain all these secrets of Ayurveda to us and help us to apply these in the field of our practice. So I thank our patrons, Dr. Shailendra Yadav sir, Chairman JS Group, Dr. Sunita Yadav ma'am, Director JS Group, and our beloved Principal, Dr. Surendra Kumar Bishwas sir. Of course, all the organizers like Dr. Niharanjan Mahanta sir, Associate Professor Panchakarma, myself, Dr. Preeti Sahu, Associate Professor from Kai Chikitsa Department, and Dr. Shrinath VS, Assistant Professor from Panchakarma Department. So we all welcome you to today's Parva. As we all know, we have completed so many episodes. We have started this sessions, all these webinars from 25th April 2023, and already we have reached Parva 16 today, and so many knowledgeous people, so many teachers have guided us in this path, and we have reached today to organize a webinar on necrotizing fasciitis and diabetic foot ulcer and its management in Ayurveda. And our today's guest is Sunil Roy sir. Dr. Sunil Roy sir is a very good practitioner. You all will enjoy today's session. So let us just remind me some lines to you that registration is mandatory. Registration is done through filling in the Zoom forms. After filling in the Zoom forms, you have to join the WhatsApp group Prabodhini through the link provided, as all the further proceedings will be intimated in the group. On successful submission of the form, you will get a confirmation mail containing Zoom meeting joining link. Please join the webinar with the link provided. This link is unique to all the members. So it differs from member to member, and your name will show according to the link you have joined. Your name and email ID in the Google form should be correct as it will be used in your e-certificate. So please be very careful while filling up your name and email IDs. E-certificates will be provided to all the participants attending the webinar more than 45 minutes. So attendance is compulsory. Please look into the matter and please be serious while attending the webinar. So minimum 45 minutes you have to attend. So that contains the main content of the session. You will get your e-certificates through email ID registered with us within 7 days, and thus there is no need to share your email IDs during the webinar sessions. So all the people who are registering with different email IDs or email IDs using their friends' email IDs, so you have to inform us. Please use your own email ID to register with us. So with this, I thank you all. And next, I will hand over this session to our professor and HOD from Shalya department, Dr. Ravindra G. Verma sir. And I will request him to please introduce our today's guest and carry over the scientific session forward. So thank you so much. Please, Dr. Ravindra sir, take over the session.
Thank you, Dr. Preeti ma'am. So good afternoon to all. Om Dhanvantraya Nama. It gives me immense pleasure to introduce our today's guest speaker and my PG colleague, Dr. Sunil Roy, sir. Sir is presently working as a lecturer in the Department of ShalyaTantra, Government Ayurvedic Medical College, Nagercoil, Tamilnadu. Sir has completed his graduation from Dr. MGR Medical University, Chennai in 2008. Sir has completed his post-graduation from Ayurved Mahavidyalaya Hubli, RUHS Bangalore. Sir has total 11 years of teaching experience till now. Sir has received 2 Best Paper awards. The first one in Undcon 2018, organized at STM Hassan, Karnataka. And the second one in World Ayurveda Congress 2022 at Goa. Sir has participated and was a chairperson at different conferences, seminars, and workshops. Till now, Sir has published 2 research articles. With this short introduction, I heartily welcome our today's eminent guest speaker, Dr. Sunil Roy. Thank you, ma'am. Now, I hand over the session to Dr. Sunil Roy, sir. Sir, you are not audible. You should unmute yourself, sir. Sir, please unmute. Sir, Dr. Sunil, sir. Sir, you are not audible.
No.
Hello?
No. Hello.
Yes, sir. Yes, sir. Now you are audible, sir.
Okay. Thank
Yes,
you.
sir. Yes, sir.
Okay.
Yes, sir.
So first I will share my screen 1 minute. The screen is visible? Okay.
Yes, sir. You need to do it in a full screen mode, sir.
Yeah, I done it. Now?
Yes,
sir.
sir. It is visible.
It's visible in full screen?
Just make it full screen, sir.
Okay.
Full screen. Yes, sir. Now
I
it is in
made full screen.
Yes, sir. Now it is in full screen, sir.
Okay. Thank you, Dr. Ravi Verma, for your nice introduction and inviting me to this wonderful session. Hello? Yes.
Sir, you are audible, sir.
Hello?
Yes, sir. You are audible, sir.
Yes. Now, topic of today presentation is Ayurvedic management of necrotizing fasciitis and diabetic foot ulcer. So, first, I will like to give a short introduction about prana. As you all know, prana means prana gatra vichurnena is a brain continuity of the tissue or any discoloration in the skin also can be considered as prana. So the prana is the most important disease in ShalyaTantra. How Jora is the important disease in Kayija. In the similar way, Prana is the important because without understanding the principles and treatment of Jora, you can't treat other diseases. In the similar way, in Shalyatandra, all the Shastra karmas will lead to the formation of Prana. So, without having a proper understanding about the treatment of Prana, one should not practice Shalyatandra and one cannot practice Shalyatandra without the knowledge of Prana Sikicha. So Sushruta Sikicha first chapter starts with Divrenium, like all the Kajicha books starts like with Jora Sikicha. In Sushruta Samhita, the first chapter starts with Prana Sikicha. That's the importance of the Prana Sikicha. So even in modern surgery books, the wound management is given prime important. So such in olden days, Sushrutas days were also there are expert in the management of Brana. They were called as Brana Chindakas or Brana Kovida, like that. Wound experts were there at the time of Sushruta itself. So coming to the classification of Brana, they can be Nija Brana or Ahanduja Brana based on the Nidanam, based on the dosha involved in that. They can be of 15 types, and one without dosha involvement, one Shuddha Vrana, total 16 type based on the dosha involvement. Based on the stages, avastha, they are divided into Dushta Vrana, Shuddha Vrana, Rihyamana Vrana, Samyak Ruda Vrana, and Ahanduja Vrana, different type of wounds like lacerated wounds, punctured wounds, abrasions, like that. Ayurveda also mentions about Chinna, Vinna, Vitta, Shada, Pichila, Dushta, etc. So for today, we are speaking about mainly Dushta Prana or non-healing ulcers. So, this Prana Avastha, understanding of this Prana Avastha is very important. So, I just want to highlight about these different type of Prana Avasthas. So, one is Dushta Prana, Dosher Adhishto Dushta. So when the dosha involvement are more in the prana, it is called as dushta prana. They can have abnormal color, abnormal discharge, severe pain, and they are always dirghakala anubati, long standing in nature. So shuddha prana, without when the prana is without the involvement of dosha, we call it as Shuddha prana. It looks like Chigwa Kalabo, like the tongue. Tongue, it is having the tongue having small, even granulation. Papillas like that wound also will have even granulation tissue formed without any exudation, without pain, etc. So such condition is called as Shuddha Vrana. You can see in the photo, the first one is with pus, abnormal color, exudation, and second one with a clean wound. We call it as Shuddha Prana. Ruhyamana Prana, when the Prana is in the stage of epithelialization. So it's a stage. First, there Dushta Prana, that's a stage of inflammation. We can compare here. Then the wound healing has occurred, that epithelialization stage can be compared with Ruhyamana Prana, where this Kapodha Varna Pratima, divide of Kleda and Sthira Pidaga will be there. Samya Kruda Avastha is the next stage where there will be no eruptions, no pain, no swelling, and it is compared to the maturation and remodeling phase. So, to Ayurvedic understanding of prana, we should have a knowledge about prana akriti. What is the shape of the prana? Prana Vedana. What are the different type of Vedana? Vadaja Vedana, or Osha Chosha, like Pittaja Vedana, or Kandu, Gauravam, like Kafaja Vedana, Prana Varna, different varnas based on the different dosha involvement. Gandhas are also mentioned, different srava. So to analyze which dosha is involved, we have to assess about the pancha lakshana of prana, prana akriti, prana vedana, prana varna, prana gandha, prana srava, etc. So in apart from that, prashna, sparshana and darshana pariksha. So you have to take proper history about the wound. Inspection, palpation. In inspection, mainly the size, shape, edge, floor, etc. has to be examined, and palpation, the base, depth, etc. has to be analyzed. So these are the basic examination of the wound. So coming to the treatment of the wound, Ayurveda has mentioned Shashti Upakramas. So 60 Vakramas for the treatment of wound. So they are again divided into three categories: Purva Karma, Pradhana Karma, and Pascha Karma. So these Sapta Upakrama is nothing but an expansion of the Sapta Upakrama. Although Vimlapanam, Dudya Vasechanam, Tridiya Upanahanam, that three procedures were expanded into 12 procedures in Shashti Upakramas. Part of that in Sapta Upakrama is still elaborated into Ashtavida Shastra Karma and Sandhana, etc. And other procedures are to Vrana Shodhana, Vrana Ropana, and for Vaikradabhaga. So the mainly the Vaikradabhaga, Pashat Karma, which involves Vrana Shodhana, Vrana Ropana, and Vaikradabhaga has got very important role because the modern medicine lacks in such wound healing medicines. We have got lot of option to promote wound cleaning, wound prana shodhana, prana ropana, and to bring back to normalcy. So coming, I'm not going very deep into the theoretical aspect of it. Today, my aim is to share some of my experience in dealing with diseases like necrotizing fasciitis and diabetic foot ulcer. So just give an introduction about necrotizing fasciitis. It's a severe soft tissue infection characterized by progressive necrosis involving mainly the fascia and subcutaneous tissue. It involves mostly the fascia and the subcutaneous tissue. The inside muscles will not be affected by this. It's also called as it's caused by bacteria and flesh-eating bacteria. So it eats away the fascia and the subcutaneous tissue. And it is a very serious life-threatening infection. Mortality is 30 to 50%, according to modern books. They are telling up to 50% mortality is there in this disease condition. And even some people survive, they have a prolonged recovery time and significant morbidity, functional deficit were also present in most of the cases. Such conditions were considered as Dushtavrana according to Ayurveda. So, due to the contaminated wound and poor prognosis, these patients are usually neglected. So, the field of wound care is currently suffering from antibiotic resistant pathogens, even though broad spectrum antibiotics are used to treat such condition. So, current there are antibiotic resistant pathogens also were on the rise, which are challenging to the in treating such condition. So these are the clinical features. It starts with swelling like a cellulitis. It will start and it will become more severe with high grade fever, chills, toxemia, tissue necrosis, etc. And it later lead to systemic inflammatory response syndrome or multi-organ dysfunction syndrome and leading to death of the patient. So mostly this necrotizing fasciitis is diagnosed clinically based on the such clinical features and also supportively laboratory investigations like elevated WBC, elevated inflammatory markers like CRP, and changes in urea, creatinine, and electrolyte imbalance, and low HB levels were also taken into account for diagnosing this necrotizing fasciitis condition. So this study of the 5 patients we have treated at our government Ayurveda college, documented, and I am presenting it here today. So we followed here, we designed a specific protocol for the treatment of necrotic fasciitis, dividing into 3 stages: stage 1, stage 2, and stage 3. The stage 1 concentrate on controlling the infection, and the stage 2 concentrate on shodhana. It involves prana shodhana and sharira shodhana. And stage 3 involves Vrana Ropana, healing. Without Shodhana, we should not go for Ropana. That's the principle told. So to control the infection, mainly we follow Chora Sigicha in the initial stage. Second, Shodhana, both internal and Bahiya and the Shodhana. And then we have to go for Prana Ropana by following Ropana medicines like Trifala Kashayam, Jatya Adhikridam, etc. So, am I audible? Hello? Yes? Hello there? Hello?
Yes, sir. Audible. Audible.
Okay, okay. So the internal medicines used in the stage 1, that is to control infection, and we use not antibiotic. We rely on Jora Sikitsa only most of the time. We used Amrudottaram Kashayam, Bilvadi Guliga, Sudarsana tablet, and Gandhara Rasayanam. It also has an equal effect like the Gandhagam. And Rasa Sinduram is also used in certain cases to increase the catalytic, it has the catalytic activity, improve the action of other medicine, and it also protects the from systemic inflammatory response syndrome or multi-organ failure. So that will be prevented by the use of Rasa Sinduram. And the stage 2, there will be Mridu Virechanam will be done with the Avipati Churnam, because Vada Piteshu, Dushteshu, Dirgagala Anubandeshu, Virechana Prasistam, Praneshu, Vranakovidaya. Would expert will always use Virechana to do Shodhana in case of a long standing ulcer. That's a reference from Susruta. So in the stage 3, Manchistadi Kashayam, Kaishora Gugulu, and Gandhagarasayanam. So these are the internal medicine we used. And externally, we rely mostly on Prana Praksha. So even though it looks simple, it's one of the wonderful treatment modality used in Ayurveda. Prana Prakshalanam, we use Tifala Kashayam or Panchavalkala Kashayam, Tikka Kashayam based on the condition. We select mostly we use Trifala, or sometimes Trifala along with Karanja leaves also can be used. So modern medicine also today give more importance to wound irrigation. So wound irrigation is to use to remove the devitalized tissue, which are the source of endotoxin, which inhibit the fibrosis and keratinolytic migration. By removing that, for removing the devitalized tissues, these wound irrigations are very important. But when you see the biomedicine today, they are very hard to find irrigant which is not irritant in nature. So it's a wound irrigant which is not irritant. It is very challenging because so far that they use mostly normal saline is used most of the time, because antiseptic solutions also being infected and non-healing conditions, it irritates the wound and hinders the healing process. So Vrana Prakshalanam is used, and externalization of Jatyadi Kridam. So today that also modern they have lot of researchers saying that moist wound environment is needed for epithelialization, angiogenesis, and new tissue formation. A moist wound environment is needed. So that Jatyadi Kridam will provide that moist wound environment. And also this moist wound environment will is drawback of this is it promote bacterial growth also, but this Chatyadi Grudam ingredients of that will prevent the bacterial growth also, and also provide the moist environment which is much needed for such wounds. So I will just share some of the cases which were treated here. So this was the one of the first cases treated in our college, that necrotizing fasciitis. This is the condition of the patient so he admitted in the nearby medical college, and they suggested some surgical intervention, like amputation. They suggested, he got afraid and he jumped out of the college, and morning he came to our OPD. He was waiting outside my OPD. By seeing the condition, I also little hesitant to admit the case, but he told that, sir, whether you admit and treat or I will suicide, no other option. I can't go back to the other medical college. So we are forced to treat that patient. So you can see the completely necrosed tissue, and after debridement is by we can easily pass a finger inside and separate the slope. That's the nature of the necrotic fasciitis, because the inside muscles will not be involved. Only the skin and subcutaneous tissue fascia will be involved. So we can first debridement is very much important to make Dushtavrana in the stage of Shuddhavrana. So in the photo 3, you can see the Dushtavrana has into a clean wound, Shuddhavrana. So after almost 2 months, you can see the completely healed wound. So in case of in the first case. So here the case 2 is a 78-year-old male, and here also you can see cellulitis gets converted into a necrotizing fasciitis. So a necrosis of the tissue. You can see that has to be debrided. Chedanagar Kottar Mamsa has to be Chedanam has to be done, and the Kottar Mamsa has to be removed. Then we follow the 3-staged treatment. First stage, second stage, Shodhana, and next stage, Vrana Ropanam. So we had not had follow up till the end. So after once almost the 80% of the wound is healed, at the time the patient was discharged. So this is another case of necrotic fasciitis. Done debridement in allopathy hospital, but they suggested skin grafting. He was not affordable for undergoing that skin grafting treatment. So we followed the stage 2 and stage 3 treatment. So Vrana Shodhana, Sharira Shodhana, and Vrana Ropana treatment, and you can see the result. So it's also necrotic fasciitis, cellulitis developed into a necrotic fasciitis, and very long-standing ulcer for many years. It got so it healed with a big scar. So this is another case of necrotizing fasciitis. This also came to our college after wound debridement done at modern hospital. We followed the stage 2 and stage 3 treatment, and you can see the wound was healed. So it's a clear case of first case of necrotizing fasciitis. You can see that the necrotic tissue and the involvement of skin, subcutaneous tissue, and that has to be debrided, and it has to be converted into a Shuddhavrana, clean wound like this. And after the period stage 3, you can see the wound got healed completely. So all the cases you can't treat. There are some failures also. This one case developed necrotic fasciitis after an IM injection. That's a history the old lady told. So after that, from the gluteal region, necrotic fasciitis spread up to the knee level, and here you can see that the muscles are not involved. The shameful exposure of muscles, so like that. So this mainly you can see such condition in groin and scrotal region we call as fornius gangrene, or sometimes in the abdominal also it will develop, we'll call as Meilnes gangrene. So like such case, it's a very severe case. The patient was not stable, so we need to shift this case to refer this case. So apart from that, the cases treated previously, they were completely healed by the Ayurvedic treatment protocol. So you can see how the description of Dushtana was told in Ayurveda. Adi Sammo, Adi Vivruto, Adi Kadino. So these all the features you can see in such necrotic fasciitis. Adi Ushna, Krishna, black color, Bhairava, fearful to see, Puya, Puti, Puya Mamsa, Abmanopna Darshana. So unpleasant look, unpleasant smell, severe pain, Taha, Paha, Sofa, etc. These are all the features mentioned as in Dushta Vernal we can see here. So this another necrotic is in the breast, a breast abscess developing into a necrotic fasciitis you can see. So even though necrotic fasciitis is a life-threatening disorder, the treatment of such condition can be done in Ayurveda based on the Dushta Vrana treatment. So Vrana Prakshalanam and Jatyadi Grida dressing will help in solving the necrotic tissue and promote wound healing. So this is about the necrotic fasciitis. So next, I will share some of the experience about treating diabetic foot ulcer. So today we know the incidence of diabetic mellitus is increasing globally, and its complications were also on the rise. So statistics say that 15% of the people who had diabetic will develop a diabetic foot ulcer at some stage of their life. So it's a very huge number, large burden to the medical society. So diabetic foot ulcer is defined as a foot ulcer in a person with currently or previously diagnosed diabetes mellitus, and usually accompanied by neuropathy and peripheral arterial uh, disease. So it's multiple factors involved in the diabetic foot ulcer, neuropathy, angiopathy, and sugar-laden tissues, which hinders the wound healing. So line of treatment in conventional medicine include antibiotics, wound treatment, and topical application. But in spite of that, every 30 seconds, a lower limb is lost to amputation somewhere in the world as a consequence of diabetes. That's the static says that every 30 seconds, a lower limb amputation is done somewhere in the world due to so in Ayurveda, here also we can follow Dushta Vrana Sikicha in case of diabetic foot ulcer. Dushta Vraneshu Vidhi Megha Pushta Vraneshu Obi. That's the treatment principle told by Susruda. So the Dushta Vrana Sikicha can be applied in case of Megha Pushta Vrana also. The Vrana arising due to Madhumeha and Pushta also, we can use the Dushta Vrana principle. So this another documentation done on the 6 cases of diabetic foot ulcer diagnosed and graded based on the Wagner's classification of diabetic foot ulcer. And here also we followed a fixed protocol in 2 stages. The stage 1, we given importance to like necrotic fasciitis here also to control the infection, Shodhana, that is internal and external Shodhana, and controlling the prameha. So to control infection, Sudarshana tablet, Gandhara Churnam, and Vesasunduram, etc. medicines were also used in some cases. Shodhana, internal and external. Internally, we not village done immediately. So, Ritu Shodhanam by Arakadadi Kashayam, etc. medicines were given, and external wound debridement with Triphala Kashayam and Jatyadino. Pramega Shamanam, we most of the cases were under insulin therapy or oral hypoglycemic drugs. So, we ask the patients to continue the medicines if any extra if they are not under control, we added some medicines for controlling the diabetes. So control of diabetes also plays a very role. Not only we should not focus on wound healing. So here this also plays a very important role. So second stage, Brana Ropana. So the wound healing, for that we used medicines like Mahatikta Kashayam, Tirfala Gugulu, and for better wound healing, we use Panjavalkala Kashayam and Jatyadigrada dressing. So apart from healing the wound, the diabetic foot ulcers, they have a chance to recurrence, and there are multiple factors involved that, like neuropathy, angiopathy, etc. To correct that, we need to rasayana therapy also very much needed. It's a Sandarpana Janya Vyadi. So Silajitu Rasayana were used particularly we use Shiva Guliga. It's one of Silajitu yoga as a rasayana in stage 2. So the treatment were continued till the wound healed completely and the follow for a period of 1 month. So case 1, this was the case already done amputation in a allopathy hospital, and on Doppler arterial Doppler study, there is very minimal flow in the dorsal. So dorsal pedis arteries 90% occluded, and the other occlusion is present in other arteries also in this case. So they suggested amputation. So above ankle amputation was suggested in this case. So he came to he it's a, in this case we had a integrative approach. The patient was directly came from allopathy hospital. We allowed them to continue the antibiotics prescribed there. We continued for a period of 10 days. The antibiotics also and along with sugar diabetic control with insulin and oral hypoglycemic drugs. Along with that, the Ayurvedic treatment protocol stage 1 and stage 2 protocol was used. So this is a grade 4 diabetic foot because gangrene. When gangrene is there, we consider as a grade 4 and bone involvement also, bone and joint involvement also there. So we can consider this as a grade 4 diabetic foot ulcer. So we can see that also treated in a period of 16 weeks. This is also another case, post amputation ulcer. It's a grade 2 because skin and deep tissues are involved, but bone and joints are not involved, and there is no gangrene. So it's a grade 2 diabetic foot ulcer. It's treated in a period of 8 weeks time period. So here another 60-year-old male type 2 diabetic mellitus patient with a non-healing ulcer. He undergone some local treatment. They treated with some local application of turmeric and some other herbs, but without proper debridement and wound cleaning, maggots formed in the ulcer and very foul smelling discharge also coming from that ulcer. So you can see here the gangrene and it was on it was auto amputation as well. By just moving that toe, it got auto amputated, and inside we are able to see maggots. So that also treated in a period of 5 weeks time. So it's a grade 4 involvement of gangrene is there. So an involvement of bone and joint is there. So it's a grade 4 diabetic foot ulcer. So it's another grade 2 skin and supervision tissue or in a it looks yeah, like a simple ulcer, but it was not responding to conventional treatment for more than a period of 1 year. So such wound was treated and completely healed in a period of 8 weeks. So this is another here amputation. This is also a post amputation with non-healing ulcer, and no at present there is no gangrene, so it can be considered as a grade 3, and it was healed in a period of 7 weeks. This is another diabetic foot ulcer, grade 2, with it's also a post amputation ulcer with maggots formation, and it healed in a period of 4 weeks. So the one observation we found that the maggot infected wounds they healed very fast. I remember when I am doing PG, myself and Dr. Ravi were there at that time. Some maggots infected wounds were treated by some of our seniors. So we used to see them as very big surprise of very challenging case. But in practice, so it's very simple because the wound debridement will be done by the maggots itself. We can remove the maggots and directly go for pranaropana treatment, and the wound heals very fast. So in all the cases, the wound heal without major amputation or skin grafting is involved. The average healing time is 8 weeks. So mostly a diabetic wound will take more than 28 weeks. That's the average of wound healing time for a diabetic foot ulcer. So in here, the first stage aimed at Prana Shodhana and Sharira Shodhana. Second stage, Prana Ropana and Rasayana. So the importance of Prana Prakshalana and the moist wound healing environment. I already discussed about this in Necrotising Fasciitis, the importance of Prana Prakshalana and Grida. So application in so the medicine used the Gandhaka Rasayana, Sudarsana tablet. They have the Jarakna activity to control the infection. Gugulu Panchafala, Arakvada Kashayam. They have Prana Shodhaka, Kafagara, Pramegagara activities. Mahatikta Grida, the Mahatikta Kashayam is used. So that is Pitta Shamaga, Rekta Prasadaga, Tifala Gugulu, and Shiva Guliya. So these are the medicine we commonly used in the treatment of diabetic foot ulcer. Apart from strict control of diabetes and proper rest or offloading or reducing the load, repeated stress to that area, and after healing also the Rasayana medicine has to be given to prevent the further recurrence. So this is another recently treated post debridement diabetic treated completely with a period of 50 days, the wound healed completely. This is another maggots infected wound. So you can hear the multiple maggots, so that healed. So in Sushruta, used maggots to treat some conditions also. Today they are telling about maggot therapy. Susruda used maggot therapy 2500 years back. This is the reference you can get from Kafaja Arbuda, treatment of Kafaja Arbuda. In treatment of Kafaja Arbuda, Susruda says to apply Nispava, Pinyaka, paste of Pulata added with Mamsa and Dadi over the Kafaja Arbuda, so that the creamy maggots will form and they will eat away the Dushta Mamsa. And after that, the maggots has to be cleaned with the Vrana Shodhana procedure, and the clean wound Vrana Ropana has to be done. That's the treatment principle told for Kafaja Grindhi. So when we were doing PG, I used to read this sloka and think about Susruda, how it is possible practically, in what mindset Susruda might have written this kind of treatment. But nowadays, maggot therapy is gaining popular all over the world, particularly in the treatment of diabetic foot ulcer, in wound debridement with medical maggots is also gaining more popular, particularly medical grade maggots are supplied in Europe and American countries. Getting them in India is very difficult, but there are some doctors, particularly I heard about one doctor from Kottar, Karnataka, Dr. Srinivas. He was is a diabetologist and diabetic wound specialist, using such maggots in the used in the debridement of diabetic foot ulcers. So, in the light of prevalence of diabetes and its complications, diabetic foot ulcers were on the rise, and the antibiotic resistance were also on the rise. There is a need to explore Prana Chikicha explained in Ayurveda. So we can these examples we can see. So diabetic foot or necrotic fasciitis like conditions also can be treated successfully in Ayurveda. So thanking you. So any discussions?
Sure, sir.
So,
We will have some question and answer sessions. If there are any queries, delegates, I request you to put in the chat box.
stop share. Okay.
Yes, sir.
Any
Who सकते हैं,
the
sir?
audience, most are UGs or PGs also there.
Yes, sir. Both, sir. Almost all the PGs and UGs are there, sir.
Okay. So
Question.
my
Isme
presentation will be of basic only. I don't know how PGs may get some new points or not. I don't know. So I made the presentation very simple and basic so that the UGs also can understand. So I not went in detail into the disease aspect. Just so some shared my experiences in the treatment of diabetic foot, and so any queries you can ask.
Hello, sir. That was a very nice
Yes.
presentation, sir. And we
Yes,
have some questions, sir, we would like to ask. So the Praveen Kumar is asking, sir, can we use Gomutra Arka in Vrana?
yeah, that also particularly in when there is kapha involvement is there, we can use Gomutra is told in the treatment, but today directly using Gomutra as all patients also will not accept. So, Gomutra Arka is used, particularly when there is more kapha involvement. We use very rarely Gomutra, etc. condition, very rarely for a limited period of time we use Gomutra, because we think that yeah, the irrigation, wound irrigation should not be a irritant. So, but in some conditions, we need for a limited period of time, we can use Gomutra or Shara, etc. Medicines can be used for limited period of time. They should not be used for very long period. That's my opinion.
Yes, sir. Sir, one more question is there. Dr. KJ Lavanya Lakshmi, she is asking that what about the blood sugar levels in all these patients? So all those cases you presented, na? She's asking about the blood
Yeah,
sugar
yeah, yeah.
levels.
So we give prime importance to controlling the blood sugar. We used when if they are insulin dependent, we ask to continue the these are if they are dependent on oral hypoglycemic, we checked the sugar levels every 3 days once, and we always try to keep it under 200. So most of the cases, the sugar levels, all are diabetic, and the sugar levels were under strict control. That's the very important part of the treatment while dealing with diabetic foot ulcer. We should have strict control over the diabetic sugar levels. Here, in all the cases, some fluctuations are there, but mostly it kept under 200.
Okay, sir. Next question, sir, is from Mahesh Kumar Jang. He is asking, is Dhupan Chikitsa can we apply in such condition? Dhupan Chikitsa.
Yeah. Dupana is also one of the treatment. We follow such a treatment in foul smelling condition, particularly in charcoal foot wounds, like that conditions. We use Dupana with Gugulu Panjabala Churna. So Gugulu Panjabala Churna can be used for Dupana. So in these cases we have not used, but we can use after prana prakshalana, we can give prana dupana, and then we can go for dressing. So sarjarata, gugulu, along with the nimba, sarshapa, etc. Can be used for prana dupana.
Yes, sir.
We
Next,
had we experienced in Kukulu Panchapala Churna that is easily available in market also, that we used to give Dupana with that medicine. Yes.
yes, sir. Next question is from Dr. Abhiranjan. He is asking how to approach in ulceration because of venous or arterial occlusion or thrombosis. If venous arterial occlusion is there or thrombosis is there, venous or arterial, then how to approach?
Okay. Occlusion will be in the cases treated by us also. In some cases, we had stenosis or diminished flow in dorsal pedis, etc. So DVT, deep veins thrombosis is a different condition that has to be seen differently. in minor artery occlusions can be handled by Ayurvedic treatment itself. So, or we can adopt Vadarikta treatment. We can incorporate Vadarikta treatment also along with that, like Manjistadi Kashayam and Srodhorodhaka medicines. Sometimes Manjistadi Sharavasti, like that. Medicines also used in case of arterial occlusion. But when the larger arteries are occluded, it's very difficult to treat. Sometimes surgical interventions are needed. Minor distal arterial occlusions we can manage by Ayurvedic treatment.
Yes, sir. So next question is from Ashwin Swami. Sir, there is a need to autoclave the medicines which are used for Vranodhan and Vranaropan. So if autoclaving is required or not for those medicines?
No, we not following the Vana Prakshalna. That has to be prepared sterile. That has to be boiled and kept in a sterile place, and that can be used for Vrana Prakshalna. And medicines also, Jatyadikrita, etc. medicines, we are packaged medicines directly we are applying. We only the glass roll and dressing materials we autoclave. The Vrana Prakshalna medicine and local Jatyadikrita we never used to autoclave.
Yes, sir. One more question is from Rakesh Reddy ji. So he is asking that what about non-diabetic wound? Non-diabetic wound first discharge is there and the condition is same since 5 months. So how can we treat it?
So if it is more than 1 month, then there should be some pathology that may be a local factor or systemic factor. Sometimes that may be due to some systemic illness, low the immunity is low, or low HP, or poor nutrition, or severely immunocompromised conditions. Like that, we have to check, or any local factors like repeated injury to that area. So, what their occupation. There are many local factors. If they are giving proper rest to that area, like that are there. Apart from that, old age, nutritional status. So apart from diabetes, there are many factors which hinders the wound healing mechanism. That has to be systemically examined and identify the cause, and that has to be removed, and then wound has to be treated based on the Prana Shodhana and Prana Ropana principle. So that has to be done. So some cause should be there, that some very rarely without cause also there, that has to be treated as Dushtavrana, the same treatment principle we adopt. But most of the time we should try to find the local or systemic cause which prevent the wound from healing. Because wound
yes.
healing is a natural process. Okay.
Yes, sir, sure, sir. So next, I think everyone is getting the answer and everyone is able to understand what sir is explaining. Sir, there are lots of questions, sir. So now we will go to the next
Okay.
question. Dr. Priyanka Bhatt is asking, sir, is there any role of honey in wound healing? Honey.
Honey, yeah. One of the Susura Brana Sandana, Madhu and Krida were the very important wound healing materials told by Susruda also. Today, there are many researches are also, we can see the use of different type of honey in the treatment of non-healing ulcer. We experienced in using some patent medicines containing honey and other ingredients like karanja that we are trying. We have used and honey alone as a treatment. We and not having much experience in using honey alone in the treatment of diabetic foot ulcer, etc. So that has to be here only. It's a UG college I am working. So if it is a PG, when PG comes, we'll future will make it as a thesis study. Then, but definitely there's got a role, and but I myself not having much experience in treating honey alone. We have used honey along with some other medicines. Using honey alone is very rarely we use here.
Yes, sir. One, two papers also published on this use of honey
Yeah.
in ulcer.
Yeah.
She's
Then
asking for
we should.
dressing purpose only. So next question we will take, sir. Dr. Ashwin Murali is asking, can sphatic gel be used for Ropan in these cases? Sphatic gel.
Yeah, Sphatic Jala, that for Prana Prana Prakshalna, we can use Sphatic gel. It is less irritant and having antiseptic properties also. So it's when we can use. So here we, in our Shalya department, they used to prepare for some netra and other. We also used that that Spadika Jala in prana cases that we can use. That's
Yes, sir. So next question we will take, sir, from Kritika Sharma. She is asking that for wound dressing, can we use Durvadi tel or Vrankuthar tel or any other preparation told by Shushrut instead of Jatyadi tel? So if any other oil we can use for dressing purpose, she wants to know.
Durvadi Gridam and we have other we use Jatyadi Gridam. Very rarely we use Mahatikta Gridam. Durvadi Gridam also we use sometimes, and some Parantyadi Kieram on Thailam is there. Parantyadi, when there is Visha involvement, it is told in Visha Sigicha. So these are the medicines we used. Comparing that, Jatyadi is having Prana Shodhana and Prana Ropana activity. Mahatikta is used when there is Visarpa, like very spreading conditions. Pitta involvement is more. We use Mahatikta Krida for local application, and Turvadi Krida also can be used in Visarpa like conditions. When Visha involvement is there, Parantyadi Kera like medicine. So these are the commonly used medicine in our practice.
Yes, sir. She's also asking for Madhu Sarpi. So I think it can
Madhu
also
Sarpi,
be.
yeah, it can be used. It's one of the wonderful medicine. We have one medicine, Madhu, Sarpi, plus aloe vera and some karanja taina. So this combination one medicine is there. That you use extensively in the treatment of prana, healing ulcers.
Yes, sir. And one more question, sir. A wound dressing should be done on every third day or daily basis. So what should be the gap between the dressing days?
In IP care, we used to we advise them to do everyday dressing, and particularly in the initial stages where exudations are more, everyday dressing is needed. In the later stage, we can do alternative days, but in our patients, we usually suggest them to do dressing daily once.
So we should do it daily. It will be better, sir.
Daily, that will be better.
Yes, sir. So next question we will take, sir, from Dr. Praveen Kumar. Sir, which rasayan is helpful in Dushtvrant? So ekmulik herbs, he is asking, which herbs we can use as rasayan?
That depend on the what kind of ulcer it is. In case of, as I told, in diabetic foot ulcer, Silajithu will be the best rasayana, because in apart from that, Amlaki rasayana, in when there is neuropathy is the main problem, then we can use ashwagandha or medicines as rasayana. So that you can't generalize based on the individual case. We can adopt, particularly in case of venous ulcer, we advise them to take Kaishora Gudulu as a rasayana for a prolonged period of time. So, like that, different medicines can be used based on the condition. Ekamulika, like Amlaki, Ashwagandha also can be used, and compound medicines like Kaishara Gugulu or Shiva Gulika, like that medicines also can be used.
Yes, sir. So next question we will take, sir, Dr. Rekha Mithun Kumar. She is asking that how can we approach the case of gangrene of the spine? Spine gangrene.
Gangrene of
Spine.
gangrene of the
Spine.
spine.
Yes, sir.
So gangrene of the spine.
Spine
I have
means
not.
maybe the gangrene is near the vertebral column or
Okay,
something.
okay. Okay, that may be due to bed sores. Commonly, we can see in the sacral region gangrene in case of immobilized patient. The bed sores will form and their gangrene may develop. That anywhere gangrene form, that has to be removed. Kottar mamsam. It is a kottar mamsam that has to be debrided. Chedanam has to be done and removed. Um, then it should be treated, made in the Shuddha Vrana and treated. That's the treatment principle. So,
Yes, sir. So, sir, next question is from Dr. Bishwanath Mishra, sir. He is asking that if diabetic ulcer can be cured by Ayurvedic treatment, then what is the need of amputation? So maybe he's asking that in which condition amputation is the only choice. So if you can.
so
answer.
in most of the cases, we can prevent large amputation, because if you follow Ayurvedic treatment, we can convert at the level of amputation at the level of angle, and we can only the toe amputation to that level we can stop. So we can prevent our post our the level of amputation we can prevent by Ayurvedic treatment. But there are cases, asadhya conditions also there. All cases can't be treated successfully. There are, if the patient cooperation or the patient not following pathya and uncontrolled diabetic or alcoholic, or sometimes their body condition will be like that. So all cases we can't treat. Most of the cases we are getting good results, but there are some failures also. So that's but comparing, there are many cases which are suggested huge amputation. By Ayurvedic treatment we have prevented them into minor amputation and saved the limbs. That's what my experience is.
Yes, sir. So we will go to next question, sir. Sangami Venkataraman. She's asking. that can we give other Shodhan measures along with these treatments? So which supporting measures we can? Shodhan means I think she is referring to the Panchakarma treatments.
Panchakarma.
So-
Okay. Okay. We tried Virechana we use in almost all cases based on the avastha and their koshta. Whether we use Vipati Churna or Padola Muladi Kashayam or Aragudadi Kashayam. Like that, we do Shodhana. In some cases, Vasti also tried in cases of arterial occlusions, etc. Other Shodhana procedures like Rekta Mokshana, Jelukavacharna in case of, we use it widely in case of venous ulcer conditions. Very good venous ulcer condition, Rekta Mokshana has got a very good role. So that three we can use widely in the treatment of Vrana. So other Vamana and Nasya, we not have much experience in that.
Yes. So, sir, next question is from Nitya Nagarajan. She's asking, can we use Shadadota Grita in wound healing, sir? And why should we use Jatyadi Grita in Ropan stage? Why can't we use in earlier stage?
Yeah,
So two
we
questions
can
are
use,
there.
okay, so we can use Shadadota Grita when there is, it is mainly used in Dakta Vrana or burn wounds. Since it is what modification is there, particularly instead of when preparing Shadadota, instead of washing with plain water, we can wash it with Panchavalkala Kashaya. Panchavalkala, by using that Panchavalkala Kashaya, we can prepare Shadadota. It is very good in treating prana opana activity. So Jatyadikrita it can be used in both stages because it is known for the specialty of Jatyadikrita is that only it can be used for prana shodhana and prana opana as well. So that only in two stages we can use Jatyadikrita. Shavdodhakrita we can use with this modification, you can use more effectively for prana ropana activity.
Yes, sir. So next question is from Dr. Rucha Selkar. She is asking, what are the special investigations we can carry in Dushta Vrana? Any investigation we can do?
That based on the individual cases, all cases, we should go for routine blood test. All the routine blood test has to be done. CBC, inflammatory markers, electrolytes, because in chronic, acute, and conditions like necrotic fasciitis, electrolytic imbalance, and renal functions are also has to be checked, LFT. So, and in diabetic, HbA1c and other. So, and when we suspect some venereal ulcer in venereal diseases, then is VDRL, like that test can also be conducted. So this basic blood, no, nothing very specific are there. Based on the condition, we go for the blood tests.
Yes, sir. So all the diseases which show skin manifestations, we can go for the investigations to rule out.
Yeah, yeah,
Yes,
yeah,
sir.
yeah.
And then again, sir, one more question is there from Vaishnavi Meher. She's asking that in all the cases, only Ayurvedic drugs were used, or along with allopathy or modern medicines, they were used or not?
In very few cases, they directly came from allopathy hospital. They were asked their antibiotics and other medicines were asked to continue. Some patients with some taking medicines for occlusions, arterial occlusions also. They were not stopped. Along with that, we given, and all the patients for they are insulin or oral hypoglycemic, they used to continue. So it's a in most of the cases it's an integrative approach, and in some cases when the patient came in later stages, like the acute phase was over and they came in the second stage, etc. Pure Ayurvedic treatment was followed in such cases.
Yes, sir. So next question, sir, is from Dr. Praveen Kumar. He is asking, sir, can we give the Nagercoil Mool Kashai in diabetic foot ulcer? Nagercoil Mool Kashai.
Well, I personally not used that medicine, so I'm not able to comment on that.
Yes, sir, but
Okay.
they can try it and
That-
get the results. Sir.
Okay, yeah. That you can try. Can take it as a research. There is lot of scope in this area because, as I told, there is a huge scope for wound treatment, Ayurvedic management, alternative, all in modern medicine also they are trying everything, hyperbaric oxygen, ozone therapy, many new methods are coming. So it's we should also update and more armaments we should have to fight this against this condition.
Yes, sir. Sir. One last question, I think it is from Swati Shri Manimaran. So she is asking, can we do Vrana Chikitsa for chronic Kushta?
Yeah, this all it is told in Susula itself. Dushta Vraneshu Karyam Mega Pushta Vraneshu Abhi. So Prana Sikicha in Kushta, when you see Vaikrata Bhagasikicha, Pandu Karma, Krishna Karma, they are can be followed in Shudra. That's and Shashti Upakramas can be followed in many of the Kushta also. For us, Gatra Vivarnam Karoti is also Prana only. It's whether sometimes the Kajicha people can diagnose it as Kushta, sometimes we diagnose it as Prana only and treat accordingly. That's possible.
Yes, sir. So
Okay.
that was a really fabulous session, sir, and I think all our questions are finished till now. No more questions are there, no more queries are there, and you explained so nicely, sir. So I will hand over the session to Dr. Ravindra Verma, sir, to take the session forward.
Thank you so much, ma'am. So it was a very interactive session rather than a webinar. Sorry. Very
Okay. Many questions.
Yes,
I also not expected a webinar will be this much interactive. All I thought with it, if this and all will wind up like that. I thought that's the usual happening in webinars.
Yes,
But
sir.
this was very.
No, sir. The topic was
felt,
yes, sir. Yes, sir. The topic was also so nice, sir. Like it was has to be like very interactive only, sir.
Okay. Thank you, Ravi, Dr. Ravi, for giving this opportunity to share my ideas. Okay.
Yes, sir. Yes,
Thank you.
1 second. Yes, sir. Sir. Yes, sir. Sir, I would like to give you a vote of thanks. Yes. So I would like to thanks. So I would like to thank today's eminent guest speaker, Dr. Sunil Roy, sir, for delivering a very informative, elaborative topic on prana, which is a very need of our or like very need of today's era. We can tell like that. So thank you so much, sir, for your presence of what do you call time. You're giving your opinion on different types of questions and explaining the Vrana in very elaborative way. Thank you so much, sir. I would like to thank our beloved honorable chairman, Dr. Shailendra Yadav, sir, and respected Director Madam Dr. Sunita Yadav Ma'am for providing all the financial aids for this webinar. I also thank our respected Principal Dr. Biswal Sir, Vice Principal Dr. Rambabu Sir for providing this opportunity. I thank to the technical team of Prabodhini for providing a very good platform for this session. I also thank to all the delegates of Prabodhini who were active, who has taken the active participation and had a very patientful hearing during this session. Lastly, I thank to all the team who has actively participated and conduct this webinar. Thank you one and all. Now I hand over the session to Dr. Pritimai ma'am.
Thank you so much, sir. That was really a fabulous and mind-blowing session. And thank you so much to our guest speaker today, Dr. Sunil Roy, sir. So with this, we will move forward and we will end this session with our national anthem. So please be ready for the national anthem.
एक ही मिनट मैम बात करके कितने पार्टिसिपेंट्स हैं? हेलो सुनील सर, हाउ आर यू?
Fine. Hello? Hello?
Hello sir, Dr. Sarita here. How are you, sir?
Yeah. Fine. How are you?
I'm also fine, sir.
Okay.
Very nice to see you, sir.
Okay,
sir. We will meet soon.
I also feel very happy to. Okay,
yes, sir, yes.
we'll call you.
Okay, sir. Okay, sir. Take care, sir. Okay, sir.
Okay.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Jai Hind, and I will request, first of all, thank all the delegates who are still here. More than 100 participants are still present here with us. So you all will be receiving your e-certificates on your registered mail within 7 working days. And we will upload the video link of this class also. So you all will be receiving the link. So please be there in the Prabodhini webinar group. Please don't leave the group, because next proceedings also we will share in the group only. And thank you so much, sir, for being here, Dr. Sunil Roy, sir. Thank you so much, sir. So
Thank
with
you.
this, we end this session today. Namaskaram to all.